Hi, everyone, and welcome to today's webinar, How DSOs Can Benefit from Consolidating Technology Vendors. Thank you so much for joining us. I'm Erica Carbajal with Becker's Hospital Review, and I'm thrilled to be joining the session today. Before we jump into it, I'm going to walk through just a few background notes to keep in mind as we move through. So we will begin the session with a panel discussion. We certainly welcome any comments or questions, so you can go ahead and submit any of those as they pop up by typing them into the Q&A box you should see on the right side of your screen. The session is also being recorded, so it will be available after the event if you want to reference back. And to do that, you'll be able to use the same link and login information that you used to log into the webinar here to access that recording once it's available. And if at any time you're having any technology issues, just try with audio, video, just try refreshing the browser. And you can also go ahead and use that Q&A box for any technical questions as well. We're here on the back end with those. So with that, I am excited to introduce each of our four speakers today. First, we have Dr. Robert Morrison, CEO of Morrison Dental Group. We're also joined by Dr. Dipesh Patel with Blueprint Smiles Dental Group. We also have Dr. Kathryn Alderman with Nebraska Family Dentistry. And finally, Brian Doyle, Senior Vice President of Sales at Rectangle Health. Thank you all so much. Before we dive into the questions, I'd just like to toss it over to each of you if you want to share a bit more about your organization or your background, any context that might be helpful for attendees. Dr. Morrison, do you want to start us off?
Sure. I'm Dr. Bob Morrison, and we're located in Virginia. We have 10 locations. We are comprehensive general dentistry. We also have specialty. We have perio. In fact, we just opened a perio and implant center. And we've had more offices, but we've merged them. We're trying to be efficient just like everybody else. I know some of us down at the conference this weekend heard a lot about same-store sales. We've been concentrating on that since about 2018. And we've seen about 25% growth in revenue without increasing number of locations. So sometimes that's increasing number of rooms or moving an office or something like that. Personally, I spent 10 years in the Navy. And in 1992, I opened an office in Virginia, and 2001 was when we got our next location, and then we went on from there.
Thanks, Dr. Morrison. Dr. Patel?
Thanks for having me. I'm Dr. Dipesh Patel. I'm the CEO of Blueprint Smiles. We're a de novo-based group now. We were an acquisition. Now we kind of switched to de novo. Group based out of Atlanta, Georgia. We have 6 locations, going on our 7th one. About a month from now, we'll have that one opened up. And I just jokingly say I'm a recovering dentist. I practiced 11 years, and now I'm full-time in the CEO role of our organization. Just like Dr. Morrison, we have been pretty strategic in our growth pattern. We haven't been just acquiring. We've been expanding our footprint within our own location, same store growth. We've been probably doing a little bit after them. We started really that in about 2020. Right at the COVID turn. And I think now you're seeing a big switch to that we were at the same conference, and they're speaking about the same thing, about everybody's now focus is on same store growth. Well, that's been our focus since 2020. In reality, we actually haven't picked up but one location in between from 2020 till now.
And finally, Dr. Alderman?
Well, so I officially am CEO of Nebraska Family Dentistry. We have 7 startup locations, and really all locations were de novo. And really my passion was to have them busy and to have them profitable and to have them successful the first year. So I really became really good about doing startups and having that growth very quickly without spending any dollars on Google ads, without spending $1 on Google ads or ads. So I just have a magic to get startups really busy and really successful. But then just like a doctor's here, it's been about organic growth for the season practices now, and really finding a ways for them to keep growing every year and becoming more profitable. But we were supposed to open 2 more startup locations in 2023, but everything changed. Everything changed. I actually put a hold on a construction, everything. And instead I went to MIT AI school. I just did it. I just one day I decided that just because I love marketing so much and digital presence, and I just, love it so much. I went to MIT AI school, and now I know how to create AI products and services. I understand it. I speak AI. So really, I'm kind of in this pattern, like, what am I going to do next? But really, I'm really passionate about AI and bringing it to dentistry and really helping teams still to provide a compassionate care, but uniting with AI for efficiency and support. So AI is not here to replace humans, but AI is here to support them. And, and I just like creating AI products, so that's where I'm at. That's what I do.
Thank you all for touching on that. I think you're already speaking to a trend and just topic we're hearing more and more about and covering more and more on is just around that growth without necessarily picking up new locations, and a lot of hesitancy in that area in terms of picking up new locations right now. Ryan, before we dive into the questions, I want to turn it over to you as well. Share a bit more about yourself and Rectangle Health.
Yeah, thank you, Erica, and thank you, Beckers, for hosting us. This is fantastic. I love doing these, and thank you to the three doctors. I love hearing your inputs and your experiences at the clinic level. So my name is Brian Doyle. I've been with Rectangle Health 14 years. I am the Senior Vice President. I run our enterprise channel, our technology partner channels, and I've kind of worn a lot of hats at Rectangle over the years. So Rectangle Health has morphed a lot. We've been around 30 years, but over the last 4 years, we've really changed what we've done in the market. We were a payment software for about 25 years, and we did that very, very well in dental. But now we believe in a consolidated platform approach that is all designed to do exactly what the doctors just said, and improve efficiency, improve SSVGs. We talk about same store growth all the time. It is about doing more in the business side of healthcare through technology and through innovation. So that's what we believe. We believe in faster access to cash. We believe in EBITDA growth. That is what we're trying to provide through technology in today's market.
Thanks, Brian. I'm hearing more and more too around just efficiency beyond the payment process.
Absolutely.
Patient engagement there. So to start us off, I want to just talk around some of the top challenges. So as dentists are finding it more difficult to operate private practices, we're seeing dental and DSO consolidation grow. So within that space, what are some of the top challenges and opportunities this is presenting to the DSOs? Dr. Patel, do you want to start us off here?
Yeah, I mean, one of the things that's top of mind for me is the cultural aspect of, if there's more practices that are trying to be sold to groups and DSOs, DSOs have to be very cognizant, or groups have to be very cognizant of, is this practice that we're going to take on a cultural fit in our organization? And with the HR challenges that everybody's still facing right now, that's probably the top of mind thing for me. When we're looking at, we look at de novos for the most part, but we'll look at a few acquisitions here and there. And now, honestly, that's the reason why we went into the de novo space more than acquisitions, is because of the HR challenges and the cultural challenges of integration of all, the teammates that would be inheriting. So I think that the challenge is that the cultural and HR, but the opportunity is also, if you are a DSO that is looking to acquire, and you can kind of get into the fabric of the office you're looking into and see what their culture is really like and have some alignment there, then it can be extremely successful, because you probably have some back-end support that not all private single practices may have. So I think there's opportunities for the right ones, but it has to be tastefully picked on both sides, so it's a success story instead of a disaster, which usually leads to turnover and all the other challenges.
And Dr. Patel, when you mentioned when you're thinking about cultural fit and considerations there, mind just sharing, what are some of those top considerations when you're trying to make that determination?
A lot of things. Alignment is number one, right? We're talking about technology here, right? If we are a very tech-driven organization, so we like all the gadgets and gizmos that lead to efficiencies, well, they may not exist in a lot of single practices that are up for sale. So as a result, inherently, people don't like change. and a new boss, for example, is already scary enough. Then that new boss comes in and goes, we're going to change X, Y, and Z, from practice management software to payment processing to onboarding, you name it. We are going to change things. And if that fabric isn't cohesive, then ultimately you're going to have turnover because people don't like change. And especially if they've been at a location for 20, 30 years, they've been used to their ways and you're used to your ways, and you have to be in synchrony to help that happen. So those are some of the challenges that I'm typically seeing when we're onboarding. So even if I'm looking at some existing practices, the number one thing I'll look for from the get-go is what technology is already in place. That includes PMS systems and whatnot. Do they have any technology? I hate to say it, if there could be a great EBITDA practice for us that's highly discounted and the team's been there for 25 years, no turnover, and let's say they were all paper, nothing digital, I probably won't touch that still. No matter on the books, it may look perfect, right? Retention may look perfect, but I know in our model, it's not going to look perfect for them, right? So I'd be doing disjustice to my current organization and whoever we're bringing on to them as well. So that's some of the challenges that I personally would avoid.
That's a great point about getting into the practice and checking it out. Dr. Alderman, I see you nodding along. I want to turn it to you here as well. Any other key challenges presented to DSOs right now amid all the consolidation?
Well, I just agree with Doctor. HR factor is always a concern. That's been a concern since I started doing startups. It's been a concern before the pandemic, during pandemic, after pandemic. I do think there has to be strong systems for onboarding and training people, and that's the only way to survive HR and to have a strong team. So I believe in a strong onboarding, strong mentoring, and investing in people. And investing in people, and if they want to learn, and if they, again, to gain that alignment, is when we onboard them. And if during onboarding we feel that there is no alignment, I learn to let people go and not to waste our time, not to waste their time, and not to hurt our organization, because it's not going to work. So I learned really the really importance of onboarding, and it's not negotiable, because onboarding allows us to know, is this person going to align with our culture? Will they be, do they want to be here? Do they want to come to work? So HR has always been a concern, always. But I think the best way to overcame it is consistent onboarding and a really strict onboarding, really, and then following up with a professional development and really spending time investing in people and working with people. It's exhausting and it's time consuming, but really spending that time developing people, supporting people, staying in touch with my employees, regardless of how many locations I have, or regardless how many team members I have. Like, it's a constant communication, like, hey, how can I support you? How is it going? So onboarding and checking in, that has been a solution to HR problem for us, but HR problem will never go away. I feel like that's been since the day I started the first practice. It's just we know how to manage it better at this point, and we have ways to manage it and really not to lose money on it. And now when I bring on an AI, really I will even make more money, because I don't want to say make more money. I will decrease mistakes even further, because I will automate how their interactions up front are happening. So that's so onboarding, checking in, and now bringing the AI that I know that is consistent and great in responding to patients and allowing me high conversion every time, not relying maybe on my not so well-trained people or not so experienced people yet. So that's where I'm at.
A lot around HR and the cultural aspect. Dr. Morrison, would you underline that as well, or point to another?
We also have done, 50-60% of de novos. We've really gone to that. But for the right one, and we've done some successful acquisitions. We've done one or two really kind of almost disastrous ones. And you learn from those. But you asked about challenges and everything. There's a lot of challenges out there. It's harder for people to own their own practice, even if they can get the funding depending on the amount of experience they have, they don't have the skills, they don't have the business background. What I tell people in our business is business is not a dirty word. And for 30 years, I've told our teams, we are a business and our business is dentistry. But if we don't run it like a business, well, we'll be out of business. Yep. And it comes down to three things: core values, core values, core values. We like to say we hire, fire, and acquire on that. We do have to align. That's one of the things they do. The thing that will get me to walk away from a potential deal right away is when the legacy dentist says, well, I don't want to tell my staff until right before. Nah, we're done. I'm out the door. I'll shake their hand. I tell them to have a nice life, but I'm not going to do that. We'll be the bad guy because they see that. But it's interesting. Dipesh said that, you know, they don't like change. They might have been there 15, 20 years. And so they leave. But if they leave, they just got change. So we do bring in almost immediately. I mean, as soon as we can, we change it over to our practice management system, but we don't do it with them alone. Almost everybody in the office has a mentor there for the first 3 to 4 weeks and bring it over. We started with AI actually several years ago from revenue cycle management, as well as imaging and you know, we were fairly early adopters. Obviously, we were early adopters from a cloud-based business, and that makes it easier to do a de novo or an acquisition. I like technology, maybe not as much as Dipesh, but I like technology that works. I don't want technology that sits in the corner and the clinic jacket is on it. But I do like technology that works and how you present it. And it gives us an opportunity to present and train on technology that's going to make us more efficient, but also make the person more efficient. And often ask anybody, would you rather scan something or, you know, fill a tray with VPS? Yeah. I can tell you which one the assistants want, much less us. So I think one of the big challenges is turnover of talent, but that's our opportunity too. Your reputation, your brand can be the anti-large DSO, if you will. And so that's a true opportunity for us. And we try and exploit that opportunity whenever we can. And the last thing I say is the opportunity is don't be afraid to beta test technology. A lot of companies out there we'll bring it in. We'll bring it in 1 or 2 offices and we'll test out. We don't always keep it, but you know, we take one of our superior teams and we'll give it a go. And if it's good, then we're going to put it in all the offices.
Dr. Morrison, I think you raised an interesting point too around just, we hear so much around the idea that, you know, younger dentists seeing more and more that they're unable to or willing to go the route of opening their own independent practice because of the finance side of it, but also what you mentioned too, the business background. Maybe we hear less so directly as that being a direct reason, but I think it raises an interesting point there. Brian, what else would you add to tie any loose ends up here on challenges facing DSOs?
Yeah, we hear the same thing the 3 doctors just said all the time, right? We're afraid of staff burnout. We're afraid of integration times. We don't want to break what's working. We don't want to overwhelm them with change. We hear that day in and day out. But what we're hearing even more of is what the consumers and the patients want. And that's the difference, in my opinion, pre-COVID, post-COVID. Relatively common things that we take for granted, like a dinner reservation. You don't walk into a restaurant and they pull out the big book and find our name. It's on a tablet. We did it on our phone. They have our card on file already. that is commonplace for us. Ride share is another one. Land at the airport, you get in the car, you get out of the car, and that's it. So I think the biggest, kind of taking a piece of all three of the doctors, is technology can be scary, right? It can be a lot. It can be a lot of change. But the right technology is there to fill the manual entries, the manual efforts of the staff. It's actually there to reduce burnout. Like Dr. Morrison said, I'm sure 99% of the staff at a clinic level would rather want to handle healthcare, the patients, than do business. That's where the technology is built. And that's why a lot of there's a lot of great companies out there, to Doctor's point. Do a beta, test it out. There's really cool stuff out there. But make sure we're honing in on what's our issue and what are we trying to fix. So I think the consumers, us as patients, are shopping our dental experience specifically based off technology at numbers we've never seen in the past. That is driving a lot of the innovation at the clinic level. So to me, the days of, me personally as an office manager, I don't like that feature, is kind of going away to the patient saying, I need this to be a satisfied customer.
Or you said they want it, they demand it.
They demand it. It's a great
They
point.
really do. And the other thing is, we always talk about patient experience. The best way to get patient experience from the time they contact you, and I don't mean come in your office, is that technology. The second best is when they come in there, the people on that front desk are focused on them. They're not answering the phone. They're not trying to enter insurance. You know, that's all handled somewhere else, or with technology.
That's right. It's absolutely right.
And if I can add on to that same sentiment, you know, when I was talking about culture, and part of our culture and core values, technically speaking, for us is we are an innovative organization, right? So we are as an organization going to adapt, change pretty frequently to keep up with times. So when we're acquiring talent to work in our organizations, we let them know that. And so if we're acquiring a practice, we also want them to know that, right? And then what I meant by the turnover that sometimes happens, it's because that person isn't a good cultural fit, because they don't want that, right? And that's part number one. Part number two is kind of what Brian was saying. I have a quote up there that Jeff Bezos actually said that I wrote up there and I stick up there. And it says, where is our customer going and how do we beat them there? Right. So at I think dentistry is sometimes late to the game, right? To some degree, but from the consumer standpoint, our customers are already there. Uber did it. Netflix did it for us. You know, all the reservations app did it for us. They're already there. We in dentistry have to beat them there before other clinics get there. Right. And I think myself, Dr. Alderman, Dr. Morrison, our organizations are actually doing that. And I think to answer, the challenges for private practices and DSOs, I think they will have to focus on that if they're not, because they're not doing what their consumer ultimately wants. And I think that's the sentiment to what Brian was talking about.
Can you expand on what do you think patients expect now? I just really want to see your perspective, because it's maybe different in Nebraska versus Miami versus Texas, so because our patients have different expectations based on what states they live at, so what do you think patients expect in the same question for Dr. Morrison, what do your patients expect?
I believe the times have kind of changed, at least where we are at. Atlanta's more of a transient type of city. It's becoming a little bit younger demographics and population wise. And I hate saying this as a dentist myself. I think we're becoming more and more as a commodity to patients, right? And I've said this on a podcast before, and I hope I didn't upset a lot of dentists when I said that. Like, I like to think my patients love me and only want to see me. But over my last couple of years before I stepped away from the chair, I saw a lot of patients that started telling me, I love you, doc, but we moved 15 minutes away and now it's 30 minutes of a drive. So if something doesn't work out over there, I'll come see you. The convenience became a bigger thing for us than ever before. And that's why I use the word commodity, is that relationship still matters. I'm not taking that away, but I think it matters differently in different, rural versus urban, different states versus cities, right? And I think we're starting to see that trend here more so. That may not be the same case in Nebraska and other places, or maybe that case in Lincoln, Nebraska, and not a suburb, because that is the case in Atlanta and maybe not a small town Georgia, right? And so I don't want it to put it for face value that it applies to everyone, but that's kind of what we're seeing where we are at.
So I think patients in general, everywhere, we're in Virginia, where we're at in Virginia, we have a lot of military, so we have people from all over. A lot of people that end up staying there, and so we have a wide range. And our practice is, they're children to people that are in their 90s, and they also want to see. They want to feel that you're using the best technology. They may love, their provider, but not more than 5 miles away. And if they don't get that great experience and that convenience, and that's part of patient experience, then maybe it's 3 miles away. And so, they may move and they can do it like that because they can get right online and do it and make an online appointment somewhere. So part of the technology, you want to be able to give them a better experience, better educational experience. But we always tell our folks too is explain the technology. Tell them why you're using it. Not just use it. I mean, we take it for granted. But we really have to engage the patient in the change.
Yeah.
When I have staff, they treat or train patients on the technology, they just became invested in it. Yeah.
I agree with all of you. We see the same in Nebraska. What I have seen dramatically in the last 6 months, preference of patient to digital communication versus in-person communication in regards to appointments, insurance. They don't want to make a phone call. They want to do digital. We have seen probably 50% spike on that.
Absolutely.
Yeah, we have seen but I agree with everything that you said, plus digital communication. And my team agrees with that too. Patients don't want to make a phone call. They just want fast. They just want fast digitally.
No one answers the phone.
No one answers the phone. So
you have to
I don't
see
answer the
who's
phone.
calling first. I have to wait for that voice.
Right.
Do I know that
right.
number?
It's a great point. We actually ran studies on this because we were getting asked the same question is, well, my demographic's a little older, a little younger, urban, rural. The numbers were almost uniform across the country, regardless of age, because we all have one of these sitting directly next to us somewhere, whether it's myself as a millennial, my parents, or my son's age, right? We all have our phones and we all want instant gratification, whether that is an appointment, whether it's a confirmation, to all of our points, right? When we're in a city or we're moving or we buy a new house or we leave the state, what's one thing that stays the same? It's our cell phone number. Our address changes. So even if I owe you $20 and you bill me, bill's never getting to me. You send a text saying, hey, this is your doctor, you owe us money, click here. That open rate is 98% across all demographics.
You get paid quicker too.
You get paid significantly quicker. That's 100% right. So this is a very, very powerful tool that the great dental clinics are leveraging because the consumers crave it. That's how we want to communicate. I don't want to pick up the phone anymore. I don't.
Are you finding like text saturation is about 85% or so?
Yeah, it's about right. It's about right. It's exactly right.
I find it above 90. I feel that it's like I tell everybody text. Nobody will pick up your phone call. Text, just text. It's that's what we tell our teams and teach them to text and use a positive communication during texting. But we really almost moved to texting as much as possible. That's what we have seen in 2023.
Sounds like it's really not just about convenience anymore, but really the level of convenience and the type of convenience and meeting a wide range of patients' needs. Now, when we're talking about bringing on new practices, can you each share a bit about how your organization has approached consolidating technology partners and resources? Why this process is important in the larger, transition period of bringing on a new practice? Dr. Alderman, can I start with you here?
We really have not brought in existing practices, all of our practices, startup practices, but I have just talked about bringing technology, and I will echo what Dr. Morrison said. Usually I bring it to 1 or 2 locations and we will beta test it. And if it's good, then we will take it to other practices. But again, I will echo what he said. It has to solve a problem. And if it solves the problem, and if my team sees that it solves the problem, then it becomes integrated a lot easier. So when we bring a technology, it has to solve a problem. It has to be easy, and the team will accept it. And if it does give us a good results, then we will take it to all other locations.
Dr. Morrison, I know Dr. Alderman had mentioned they're starting kind of testing with 1 or 2 before bringing it on across all the practices. Is that something you found as well to work?
I'm doing some of it right now with some additional technology. From an acquisition mode, it's also bringing the technology in that we have in the other offices, including from the practice management software and all AI and all the other things that we may have, is also a way for them. It's an equalizer. They now feel that they're getting the same thing that everybody else is getting. And we present it in a way. We train it. We do all of that. We'll often have them go work in a geographically co-located office there to learn it and bring other people in to help the people in that acquisition office. Last thing you want an acquisition to feel is, that office that's just not getting the attention because, they weren't part of the organization. So we want to do exactly the opposite.
Dr. Patel, I want to turn to you too, just as a kind of follow-up there on when introducing, consolidating technology and doing this with a newer practice. I guess if you're thinking about timelines there, like how long would you say on average, or does it really vary depending on the organization and the culture, before it really feels like this is just part of their daily routine and it's something they are trust and have leaned into it?
Well, I think it depends on how much technology you have, number one, right? And what all it does, right? So I think we're talking about consolidation of technology. I'll speak both sides of it, since we did acquire some practices at the start. When we do that, we bring on the same technology, just like Dr. Morrison said, across all the offices, right? That's twofold. Number one, we want them to know they're not a step office of ours. They are one of our offices. As a DSO, the S in the DSO is support. Well, I can't support another office unless we know how to support that technology at their existing office. We luckily know how to support the technology that we use really well. Our LMS systems based upon it, our training, all of our other teammates that can go help are based upon it. So inherently, every time we've taken on an office, we didn't care what software they had, what they used, what vendors they had. Hate to say it, we changed it to what we all knew that we could support the best. Right. So we're going to do that. We know that from the get-go, and we think that's the best way to support them, even though it's a little scary for that office at the beginning. Second fold, when it comes to all this technology, there is a lot of great technology out there. We got into an issue personally, internally. We love technology. We try out a lot of technology and we implement a lot of technology, but sometimes you can have a tech overload as well, where you start realizing they all kind of sometimes do the same things and you're paying a little bit for each one and you're not fully utilizing every single one of them, right? So I would tell audience, if you have
Brian just got a big smile on his face.
Yeah. So if
Thanks
you
for teeing me up, Doc.
I know. So if you use they're here. So I'm going to say Rectangle Health, right? If they're here and you guys use Rectangle Health, well, they've evolved over 25 years, right? And if you were with them 20 years ago, don't be afraid to call Brian and go, what's new? Can I get retrained on what else you guys offer? And a lot of times you'll be shocked. You probably have 200-300 vendors at your location that you're using that your previous person already does. So that's that consolidation that I would tell everyone to kind of look into, because the more technology you have, the more you have to teach upon it, the more your teammates have to use, the trickier it can sometimes become. And that would wholeheartedly answer your original question, the onboarding, how long does it take? Well, before it used to take us 6 months because we had so much. Now with our LMS and we know what we like and what we do really, really well, we've kind of slimmed that down and picked the best technology, in my opinion, for what we use. I think we can onboard a whole new office in about 60 days now, right? But we're built for that now, right? We've been building it for some time. We have enough support. So from the practice management software to AI and everything else in between that we have enough of our own training systems in place to get teams onboarded a whole lot quicker. But that's also because, Rectangle Health probably does a phenomenal job training their clients on their technology, but I may not have to know it to that degree. I only may need to use a subset of how skillful they are in it for my operations. So what we do internally that could be useful is we create our own version of that technology. So we teach our teams, your LMS system knows how to do a million things. You probably don't need to use every button in there and teach every button that your practice management software will teach you if you get them to train. How about we train on the 15 things you use instead, right? And that could speed up your timeline for onboarding and training and integrations.
Well, it becomes a language.
Yeah.
The new office, it's about communication. Once everybody's on there, they can now talk with everybody else. And that speeds up the integration of that office.
Sorry, Brian, I saw you were off mute. I was going to see if there's anything else you wanted to underscore just on the topic of consolidating tech.
Absolutely. So one, thanks for the shout out, Doc. Appreciate it. But consolidation does matter. It's a powerful tool, especially for, I'm on the technology side. Of course, I think consolidation is great. It saves us top line expense. You're going to reduce workload, all of that if you want to learn more, contact rectanglehealth.com. But when we're talking about the DSO market, right? Having a consolidated tech stack is part of the sell. Like you have to compete to acquire groups. Now it's not as competitive as maybe as it was 2 years ago. We know that. But at the end of the day, the group wants to go somewhere where it is consolidated. This is our plan. This is the rollout. This is our initiative, and here's our strategy to get there. Because I think, Dr. Morrison, you said it right in the beginning, it is a business. Now, it's a dental business, but it's a business. So that tech stack that Dr. Patel just talked about, hey, when we onboard, we're going to do these 1, 2, 3, 4, 5 things. That's powerful to a group being acquired. That's what they're craving. That's what they're looking for. So that consolidated tech stack actually helps the DSO acquire, grow, de novo for going that route. It speeds up integration, et cetera. So the difference between a 6-month integration, which is traditionally what we see in the market, generally speaking, to 60 days, that's palpable to our cash flow, to our EBITDA, to the models. So it's very important we speed that up as fast as we can.
Yeah, thanks for calling out the practice side of it there too, and why that's so important in this whole conversation. Docs, I want to turn to you as well here now for this question on practices and tools or advice here when it comes to, if you're thinking back on your own technology consolidation initiatives, best practices and tools that you found particularly useful. Are there any examples that come to mind there that you can share? Dr. Morrison, do you want to start here?
Well, I'm the historical member in this. So, I've been practicing 42 years. So I remember when there wasn't any technology.
Yeah.
But I also remember in 1992, electronically filing claims. We had to do it after hours because they used dial-up modem. That's what we had. And it took a little while. So I see Brian laughing at me, but for me, it's been integrated as it was available. Whether it be some of the early technology, was just having a PMS platform that, that you could do something with, and they couldn't do much back then. In 2006, I had my first CBCT. We ran it as an imaging center because no one had them. And then you had CAD/CAM, and there wasn't any real RCM yet. I mean, there was a little bit here, a little bit there, but it really was about, getting it to get your claims, to a consolidator and sent on, and then, but I've seen it. What I was leading to is it has sped up. What you saw 10 years ago was nothing like 5 years ago, which wasn't like yesterday. And so, one of the questions, and I'm not trying to steal anybody's thunder, it is, or if we have time, maybe not, what's the advice for people that haven't get started? Find a time machine, go back about 2 years, start. You're behind if you haven't started. So that's it. That may not be the question you or the answer that you were looking for. That was my answer.
Yeah, absolutely. That's the idea of being behind. I think it just speaks to just the larger trend we see, not just throughout dentistry, but healthcare as a whole, of just tending to lag, be the laggers when it comes to technology and advancements and adopting there.
Well, with Dipesh, as he read that quote, we now need to anticipate where our patients are going to be, or we're behind.
Right. And I think it's twofold. I'm glad you said I talked about the patient part, and because it said consumer, right? I think of consumers in twofold. So honestly, my consumer is my teammates. So I think of technology for them first that uses it for who they're taking care of, their consumer, which is patients, right? So the number one, although we're looking at it from a patient perspective, most of the technology, I'm looking at it from our teammate perspective, because if they can utilize it, go faster with their time. One of our core values, number one core value, in my opinion, in our organization is respect time, as we call it, right? And so patient's time, your teammates' time, our job is to help them with that process. And to answer the question about like most useful, they say there's something good for every position, right? And so I can give you a laundry list. We'll talk about a lot of front duties because that's where it usually starts. PMS, the front's using. But on the dental side, CBCTs, there are scanners, then there's mills, 3-second curing lights, that's considered technology as well. Suction devices, all these gadgets, right? Now you can place implants with, surgical guides in place technically, right? And there's all this great technology on the dental front, and dentists are really good about that part, right? Because we're dentists, we want the tools that help us out. But there's great technology for your hygienists to call out perio probings, right? Without having to type it in, or your assistants to take x-rays quicker, right? And for your billing department to do RCM quicker, and your checkout and check-in departments to onboard patients quicker, and insurance verification. So there's something for everything. And if you're new to it, just like Dr. Morrison said, he's right. If you go just 2 years back, it exploded, and it exploded very quickly every single day. And Dr. Alderman's leading some of that charge with her AI stuff, right? She's already trying to meet the consumer before we're even there, which is great to know because we know her. So me and Dr. Morrison have a leg up right now, right? We know who to call, right? She's done all the research for us. But that's essentially what's out there. So there's something for every position. And I would tell, any executive, any CEO, any owner that's listening right now is to look at technology through the lens of each teammate you have, and how could you better support all of their roles. And that will eventually lead you to the technology that's going to support them better, which will ultimately help your organization out.
Yeah, absolutely. Not having oversight of any specific area of the business sounds like that's really critical. Dr. Alderman, is there anything else you want to add here on tools or resources? See you nodding along.
Yeah, Dr. Patel, I couldn't have said it better than Dr. Patel said. I will just add that consolidation was my goal. Basically, I can take long-standing tools and how much can I consolidate and integrate it with my main software. That's number one. But again, the goal, yes, we are caring about patients' experience, but we are caring about team experience the most.
Yeah.
And in 2023, we really consolidated a lot of that by going to cloud dentistry. And then everybody was coming to me and saying, hey, you need to add this and you need to add this. Like, no, I don't. My team is going to be technology burned out. We reached our max for technology, and actually it's not going to make the life of my team members easy. It will become more frustrated because now they have to find time to look at all of these tools that maybe alone are really great, but they're really not solving a problem for me. They're actually creating a problem. So when we bring in a technology and we're talking about consolidating, again, Dr. Patel said it beautifully, we have to think of a team members, because if we overload them with technology, it's going to be an expense to us, and it's going to be stress to our team, and it's not going to be used. So I just couldn't have said it better. Again, yeah, we want efficiency, we want to support our teams, but we never want to forget that when we consolidate it and bring in a new technology, it really has to, as I said, like I had to say no to a lot of softwares, a lot of tools, and my answer was very simple. My team has reached technology limit for this year. It's reached. I cannot, no matter how great your software, I just cannot do it anymore because I have done so much in 2023. We really have to wait and let it all process and integrate, and the team to get really comfortable using it. So that's really my 2 cents on that.
Brian, I see you want to jump in there.
Yeah, so it's fascinating because I meet with a lot of CEOs, a lot of CFOs. It's pretty much what my days entail, right? The first thing I say is let my team talk to your users. Because if we're not getting user buy-in, nothing I talk about, no ROI model I show matters. Because we have to have the clinic level users buy into it. They're our customer, actually, on our end. They're going to either tell the executives we love this or we don't like this. And that's the best advice we get all the time is let us talk to the users. Let us show the users. Sure, we'll talk about the models and everything, of course. Let's talk to the users. Let's see how they like it. So I absolutely agree with what everyone just said there.
Before we wrap up, I want to make sure I touch base back in with each of you. Dr. Morrison, I know we heard some closing advice from you already loud and clear of get started if you haven't. But anything else you might expand on there in terms of where someone might be able to get started, or something else that maybe we didn't get to that you think is important for the audience to know around consolidation technology?
Well, Dipesh is right. Dentists and hygienists are really good at adopting technology, and that's, on the clinical end. What I tell clinicians, for a lot of reasons, is you need to think outside the operatory. The operatory is your comfort level. Get out of your comfort level. And everything outside the operatory is just as important, maybe even more so.
Dr. Patel, any closing thoughts from you?
Yes, the theme seemed like it was technology and humans. It seemed like the theme was. I'm going to say, for anybody considering technology, do not consider technology in the sense of, I'm going to bring this on and it's going to help my overhead instantly, right? It's going to get rid of somebody for me. It can eventually do that for you when the time is right. The whole concept that I see technology as an augment with our humans is, can they do more with less? And technology helps with that. So technically, let's say you have 2 fronts and you introduce some type of technology. They should be able to do more with that technology while feeling less burnt out than before. That means it's solving a problem. And you want to judge that based for your ROI based on a little bit of that and how much time saving that technology does. Now, the beauty of it is, if that actually plays out correctly, that should help you scale to whatever next level you want to scale to at that office, and you won't have to add anyone else. 2 things will happen. You won't have to either add somebody else for extra capacity because the technology help augment it, Or if somebody leaves, you'll find out you don't have to replace them because technology was there enough to help augment that labor, right? And so that's how I kind of look at it. So if anybody's like, hey, I just want to take on this new gadget or whatever, it's just going to save me on my HR, which is my highest line in my P&L. Don't think of it that way yet, right? Not when you're integrating it. It could play out for you as you grow, for sure, and it should, because you have to pay for the technology, right? But that's how I look at it. So that's what my closing remarks will be, especially for people that are kind of getting into it or integrating a lot over and over.
Dr. Alderman?
Well, since I love talking about AI, and I think AI will be the future, and I really love the concept of superminds. That's a concept that we were taught at MIT school. So the AI here to create a supermind, what it means that we're not replacing humans, we are adding to the humans' abilities, and we're creating a superminds. But at the same time, it's very important to understand that if we bring the wrong AI technologies, that will actually push patients away and hinder their experience and turn patients away. So when we bring an AI technology, we really have to be bringing it super carefully, because everybody will be telling you that AI is great and they have the best product. But truly, you have to really be careful bringing AI to your offices, because really, I have seen a lot of things that look really good when they do a pitch, and then I start testing it, and it's like, there is no way I will be bringing it to my offices. So it's really important to test it and not to take somebody's promise or sales pitch. So that's really, the AI is here to create super groups and super minds. But again, how we do that and what AI technology we will bring in, it has to be done really carefully, because it's actually can hurt our practices.
Thank you, Dr. Alderman. Brian, is there anything else you wanted to leave the audience with?
Yeah, well, first of all, thank you, and thank to all the doctors for joining. This was a great conversation. It's actually what I love to talk about, so this is awesome. But when we think about consolidation, we think about technology, my biggest advice is, one, look what's out there. There's a lot of really cool stuff on the market today. Talk to vendors. I don't like that term, but talk to vendors. But then when we do it, have a strategic reason why. What are we trying to solve? Who are we trying to help? And what are our key indicators, KPIs, as we like to say in our world, of what defines success? What actually, to Dr. Patel's point, what defines success, right? How do we do that? Then we can build a plan with our partners on the market to implement the smart way, the right way, not to overwhelm. But that's my biggest advice. Take a call, see a demo, see what's out there, and then ask the right questions. And then make sure you talk about scale. Scale matters. Like a 6 location is different than a 10, that's different than a 30, that's different than 100. Make sure you're always incorporating scale into your conversation. That goes up and downstream. So make sure scale is part of the conversation with the vendors on market today.
Thank you all for helping wrap us off, sharing some closing thoughts there. That is all the time we have left on this session. Thank you all so much to each of you for taking the time to be here and speak. And thank you to our attendees as well. And finally, to Rectangle Health for sponsoring today's webinar. If anyone would like to learn more about the content presented today, please do check out the resources section, which you should be able to find on your webinar console. And we also kindly ask that you fill out the post-webinar survey on behalf of Becker's Healthcare. Thank you so much again, and we hope you have a great day.
Thank you so
Thanks,
much.
everybody.
Thank you.
Thanks, guys. Hope to see you
Thanks
soon.
all.